I'm Brad Stone. I'm with the Monocacy National Battlefield Foundation, and I'm honored to be with my good friend here, Matt Borders, who is a park ranger at the Monocacy National Battlefield Park. And we're doing a little bit of a video about field hospitals and how they work during the Civil War. And let's start out with turning to Matt and asking him about where the field hospitals were set up during the Battle of Monocacy and about the casualties suffered by Union forces there.
Sure. Thanks, Brad. It's always a pleasure to speak to the Foundation. Monocacy National Battlefield has roughly 1,294 casualties for federal forces and 900 on the nose for the Confederates. We will have 2 identified field hospitals on this battlefield landscape. The Worthington Farm, tour stop number 2, actually has a field hospital in the front and backyard of that building in 1864. And of course, the Gambrel Mill, which is probably our most famous of the field hospitals. That one was identified very early on in the fighting after some of the initial shots of the battle crashed into federal camps, wounding several soldiers from the 87th and 151st, 87th Pennsylvania and 151st New York Infantries. And of course, they developed a field hospital right there at Gambrel Mill to deal with those casualties.
Okay, so by 1864, federal or Union field hospitals were identified by the type of flag you see in the background, yellow with a big green H in them. And the general rule, Matt, was that they would set up field hospitals about 2 miles away from the battlefield, generally speaking. And the idea for that is so that they would be out of range of artillery and small arms fire. Well, that was true in theory. It didn't always work out their way, and there were incidents where these hospitals were actually accidentally fired upon, and they could even be overrun by the enemy. But no matter what happened, the surgeons and their teams here kept on trying to save lives. Now, we have a patient here in front of me who's been brought to the field hospital, and he's been wounded by one of these. This is a piece of shrapnel from an exploding artillery shell. Of course, many of you know that the main killer and maimer on the battlefield was the mini ball, but just so you can get a clear picture of it, I'm using this big chunk of shrapnel, an actual piece from the Civil War. So he's put on my operating table, and if you see a lot of TV and movie depictions of Civil War medicine, here's what you'll expect will happen next. I, as a surgeon, will take a look at it. I'll say the leg has to come off. I'll grab one of these. This is a bone or capital saw. I'll start amputating the leg. He'll be screaming, writhing in pain. Men will be holding him down. He'll be told to bite a bullet or bite a strap of leather, or he'll be given a big ball of whiskey to help him deal with the unbearable pain. Now, these are very dramatic depictions, very graphic depictions. There's only one little problem. They're totally false. Virtually all operations during the Civil War on both sides were conducted with the patient anesthetized and not feeling any pain during the procedure. They had 2 drugs they could use, chloroform and ether. Both are effective. So I'm going to demonstrate how they usually administered in this case, the chloroform. You take a copper cone like this, you put a little piece of sponge on it, you place it over the patient's nose and mouth, and as he breathes in, you got to drop in a little bit of the chloroform in this case, and after a few minutes, the patient will be out. There are usually 3 surgeons involved in these procedures. From time to time, one of them will grab one of these. This is a stethoscope of the Civil War era. They're going to use it to basically check what today we would call as vital signs. Oh, I forgot one thing. Before he even comes to us, one of the things that will be done is there'll be a tourniquet placed on his leg so he doesn't bleed out. That's something we still do today in battlefield medicine. So anyway, back to the stethoscope. I'm going to use this to check what today we call his vital signs, things like his heartbeat, his lungs, and I would use it like this. Okay, everything seems to be okay, so I'm going to start operating. Now, Matt, you probably guessed that he's not my first patient in this battle, right?
Not today, at least.
Right, so I have to make sure that my instruments are clean before I use them. So I'm going to give them a Civil War style cleaning. Goes something like this. All right.
Lovely.
Then I'm going to take this. I'm going to remove the piece of shrapnel from the wound cavity. That's important for two reasons. One, I don't want it in there, but secondly, this is the 1860s. They don't have things like x-rays, ultrasounds, so the only way they can figure out how badly he's wounded is by probing that wound cavity. Now, I do have instruments, some very similar of the type that we have today, to probe in there delicately, but in an emergency situation like a major battle, I won't have time to use them. So what will I use instead? My finger. Sounds disgusting, but you may be forgetting. I'm going to give it a thorough cleaning. All right, I'm going to stick in the wound cavity, look around, feel around, and what I find determines what I do. If it's a minor wound, I'll probably stitch him up. As a union surgeon, I'll probably use this silk thread. It is deemed the best suture material at the time. It's a pretty good material. We'll still use it today. Now, if it's something more serious, like a broken bone, but it's a clean break, what I can do is I can reset the bone, put it in splints to stabilize it, send them to a general hospital where you can get long-term, recovery, and his prognosis should be pretty good. Now, the worst case scenario, other than death, is if I find that the bone's been shattered and made pieces, and or the artery and veins are damaged beyond my ability to repair them, and or there's so little leg left, there's nothing for me to work with. Well, in that case, I will have to amputate. And what the movies and TV sort of get right is they do a lot of amputations during the Civil War. It's not because the surgeons are butchers, but this is 75 years before they have antibiotics. So unless they remove the affected area, the patient will die from sepsis or gangrene. So they become very good at doing amputations. On average, they can do it in 14 minutes or less. And by doing so, they save tens of thousands of lives. So they become very gifted surgeons. Now, you may have noticed the one big difference between surgery then and now. And that is, for all the skill being demonstrated here, there's one big problem. And that is, nothing's being done to clean, sanitize, or sterilize anything. Surgeons would go the entire day without washing their hands. They might rinse them off and dry it on something like this. Likewise with instruments, and you'll notice I'm not wearing surgical gloves or masks. That wouldn't come until decades after the Civil War. Why? Because the Civil War is not in the modern age of medicine for one big reason. It's the last major war where they don't understand germ theory. So even though the surgery here is very good, it's being done in an environment which can cause or present an elevated risk of infection for everyone, not just the patient, but for me and for the patient as well. Now, the important news, I think, with regard to Frederick, one of the good things is that once patients survived a field hospital, they had a pretty good chance of being taken to general hospitals in places like Washington, Philadelphia, and Baltimore because Frederick had a rail line, correct?
Yep.
So that's a major advantage during the Civil War, the ability to, relative to the times, be taken quickly and efficiently and humanely to a general hospital, which would, by 1864, usually be kind of state-of-the-art, where you could get the best care, comprehensive care, to take care of you until hopefully you fully recovered. So am I leaving anything out, Matt?
No, I wouldn't say so, Brad. Field hospitals were very rough, but the surgeons were doing the best they can under trying circumstances. Here at Monocacy, our best-known field hospital, we mentioned Gambrel Mill, is actually commented upon by what Brad said. They should have been well behind the lines, but Wallace himself would comment that the only issue with that hospital was that it was indeed under fire during the battle. So these surgeons, their assistants, and those nurses that are with them, they're under a real peril, not only here, but at other engagements throughout the American Civil War. So Brad, thanks for coming out here and showing us this.
My pleasure. And we both encourage you to come to the Monocacy National Battlefield Park. It's a great place to find out what it was like to be in a battle. And this is a battle of some major consequence because, again, it was the battle that saved Washington, D.C. from being occupied by the Confederate Army of Jubal Early in 1864. So with that, have a great day.
Take care.